Hello everyone. If you don't know me, my name is Marcy. I have 4 kids, the youngest of whom is right here. Her name is Freya. She is almost 6. She has a rare syndrome called Cornelia de Lange syndrome that affects her growth, development, her GI tract, her heart. She has seizures because of it, and basically every part of her life is affected by CDLS. But today, while I was doing her hair, I wanted to just do a little chit chat about CDLS and GI symptoms and involvement. So GI stands for gastrointestinal, and that is stomach, intestines, that whole tract. Now, I do not know a single person with CDLS that doesn't have some type of GI involvement. So I thought this would be a good place to start our little chit chat. I want to do a little series kind of on all of the symptoms of CDLS, specifically the ones that affect Freya, because that's my experience and it's what I can talk about. So Freya's GI involvement started immediately. When she was in the NICU, I noticed right away the signs of reflux. My oldest son had reflux, so immediately I asked, can we put her on a medication for reflux? Come here, you can't have the camera. And the doctor told me no, that often they like to wait for a couple weeks before they prescribed reflux medication, just to make sure that's what's actually going on. Here. Why don't you play with that stuff? We gotta do your hair. The first signs of reflux for me with Freya were kind of excess vomiting. She had a hard time laying down on her back in the NICU. That seemed to worsen her reflux symptoms. Freya has always made a very specific kind of gasping, but like a wet. It sounds like a wet, like she's trying to swallow back down liquid that's coming up into her throat. Those were her first symptoms. So when we got her home from the NICU, her pediatrician did put her on a medicine for reflux, and we struggled the first year of her life with reflux. It was a nightmare, basically. We couldn't lay her down flat. We had her crib up on books on one side of the crib, so she always was at an angle. We would feed her. She was tube fed for the first couple months of her life, so we would tube feed her, and then we'd have to hold her upright like an hour after she ate. And then even then she would, throw up after we put her down. You are not wanting your hair done today, are you? Okay, we'll do a quick ponytail and then you can go play while I keep chatting, okay? I was gonna do something cute, but she's not having it. I cut out dairy out of my diet on the recommendation of her GI doctor, which did help a little bit, not a ton. I also did cut out caffeine for a little bit. The GI doctor said he didn't think that was necessary, but I had read online that really helped some kids with reflux, so I was willing to try anything. And if you know me, you know I love my caffeine, so that was a big ask. I didn't notice enough difference to keep doing it. Okay, go be free and play, but you gotta leave the camera alone, okay? You can have anything else. Deal? Okay, go ahead. Now you're gonna sit still. Sounds about right. Then suddenly, when she was about a year old, I think it was the addition of a lot of solid food. She was eating a lot more solid food and a lot less formula. Her reflux got better. and we were able to take her off her medication. She still had occasional reflux that we would just use kind of like rescue medication on, but we were able to take her off her daily medication, which was huge. And then fast forward, I think probably about a year, and her reflux came back with a vengeance. I say reflux. She had GERD, which is a more severe form of reflux, and it came back. She couldn't finish her feeds. At this point, she was drinking formula from a bottle. She couldn't finish her feeds. She wouldn't eat any solid food. She was in so much pain. She had lost a whole pound, which she was 14 pounds at the time. So a whole pound when you're 14 pounds is a lot of weight. She just looked so skinny, and she was not doing good. So we went back to see the GI doctor, and he immediately suspected something called EOE, which is eosinophil esophagitis. And what that is there's an allergen present in your throat, and instead of your body reacting with typical kind of GI symptoms. Do you just want what's behind it, or do you want the camera? Let's see. Let's see if we can swap this out. She might, I have a toy holding this. She might just want that. So instead of having typical like GI reactions, you will have white blood cells kind of stack up in your throat, making it hard to swallow, making it hard to eat, causing a lot of pain, causing a lot of reflux. Now, in order to diagnose EOE, you have to do a scope for your throat, which for typical kids is not a huge deal. For kids with CDLS, it can be quite dangerous because they have a hard time with sedation. And any type of sedation can be quite dangerous for kids with CDLS. So I talked to my GI doctor, Freya's GI doctor, and just discussed with him what the treatment would be if we knew it was EOE and if that would differ if we didn't. And he basically said no. What he wanted to do was just an elimination diet and take away all allergens. And if she reacted well to that, then we would just assume it was EOE, but never really have a true diagnosis. So that's what we decided to do. When you have a medically complex child, there's always tests that need to be done. There's always stuff that needs to be done. So I always go in with the question of, does this have to be done to get a diagnosis? Can we do something else? Can we skip this test? Because it's a life full of tests. So because at that point she was eating less solid foods and more formula, we did switch her formula to Kate Farms formula. And the good thing about Kate Farms is they do have their dairy-free, gluten-free, soy-free, nut-free, egg-free. It's free of a lot of allergens. So we switched her to that and restarted her reflux medication. And she responded great. She gained weight back. She had less issues. All the solid foods we were giving her were also free of all those allergens, and it was just a elimination diet. And then we slowly added the foods back in, and currently we are only nut-free. It's kind of hard because Freya doesn't eat a lot of solid foods. She eats mostly formula to gain weight and to get all the nutrients she needs. So it's hard to tell when reintroducing allergens if she's truly allergic, because she's not getting a large volume. She'll have like one nibble of a cracker for her solid food. So we still are kind of questioning if allergens have something to do with it, but she definitely had a reaction to nuts. When we reintroduced nuts back in, she had a severe reaction to cashews, and the rest of the reactions were increased reflux with peanuts, almonds, anything like that. So we're just sticking with being nut-free and going with that. Freya has been in feeding therapy, I believe, for about almost 4 years now, which seems wild to say out loud because it does not seem that long. But we go to feeding therapy to help, one, expose her to foods, because when we started, she did not have a good relationship with food. A lot of kids that have reflux don't, because they don't associate food with pleasure and warm, good feelings. They associate food with pain. So we went to expose her to a lot of different foods to hopefully help with some of the, I say this in air quotes, pickiness. I don't consider it pickiness when it's a trauma response to food. And we also go to help her learn how to chew. With CDLS, there are a lot of the kids have a smaller jaw and a smaller head, and they also have a high palate, all of which makes eating food and chewing very difficult. So we've been going for 4 years. It has been helping very, very slowly, but we see progress every day. She's now gotten to the point where she will touch most foods, which is a big deal, and she will try putting in her mouth about 50% of foods, which is amazing and wonderful. The other issue that's fairly common is constipation. Freya really hasn't struggled with constipation. She'll have her bouts where she does, but for the most part, we've been free of that. And another GI issue that's really common is bowel blockages and where the bowels twist. It has a name. I forget what it is. I'll put it down here. We have not experienced any of that yet. I fully expect that we will experience that. It just comes with Cornelia de Lange syndrome, and it's something we look out for a lot. We track Freya's bowel movements, and we are very, very careful about if she ever has any bowel issues, we go in right away, because we don't want to deal with waiting and having a bowel blockage or the twisting of the bowels get worse. It is fairly common for kids with Cornelia de Lange syndrome to have a G-tube. A G-tube is a tube that goes right into your stomach, and you can put food through that tube. Feeding difficulties are very common with CDLS. Freya has feeding difficulties. She's 6 and still is formula fed. However, she has been able to swallow liquids, which is often an issue with kids with CDLS and often why a G-tube is introduced. We've been very fortunate. She did have a feeding tube the first 2 or 3 months of her life, but since then she's been able to handle liquids. She does struggle with thin liquids like water, juice, things like that, but her formula seems to be just thick enough that she's okay swallowing that and eating that through a bottle. Again, will Freya have a G-tube one day? Maybe. It's just a kind of wait and see type of game. So that's our experience with Cornelia de Lange syndrome and GI issues. It's one of our biggest headaches. Freya is still on medication for reflux, and it still is not 100% effective, but maybe about 75%. And hey, we'll take that. Any improvement is great improvement in my book. Come here. Ugh. All right. You say goodbye to everyone? Freya is busy these days. So Thank you for being here with us, and I hope we will see you next time. You say bye-bye? Yeah, bye-bye.